Pleasure to be here tonight, or afternoon, or depending on where you're logging in from. So, as Cindy mentioned, I have been clinically practicing in the world of spina bifida for over a decade now, and that has naturally been where my clinical research has been. Clinical research and clinical passion has kind of come together. So I wanted to really present an overview tonight of some of the research that we have done, as well as some of the research that needs to be done in this grouping, and hopefully get some other people interested in the same topic. So a bit of background, if you're unfamiliar with spina bifida as a condition, it is the most common non-lethal, permanently disabling congenital defect that impacts multiple organ systems. The life expectancy of these individuals back in the 1970s used to just be childhood. And since kind of the acceptance and innovation of clean intermittent catheterizations to empty your bladder, we really now have this huge group of adults as well with spina bifida. Clinically, this is great. Obviously, from a life standpoint, this is great. Also, from a research perspective, this is really interesting because we basically have an entire new population of individuals with new problems that we need to kind of innovate for, do entirely new research strategies for, and come up with new clinical pathways. So it is a whole new cup of tea for a lot of us. There are about 166,000 individuals estimated in the US to be living with spina bifida. I feel like it's not as well known as some of the other conditions that are less common. I have on there like sickle cell disease or cystic fibrosis, which I think the people not in science understand those conditions a lot more than they know about spina bifida. So I am always pushing that envelope so people learn more. As we mentioned, it affects multiple organ systems. Some of the most common, and everybody with spina bifida is going to be different and will have a different kind of cluster of symptoms. But commonly we'll see a combination of hydrocephalus, neurogenic bladder, neurogenic bowel leading to incontinence, often renal failure. Again, this is thankfully declining since we have improved on our care of the kidneys. Intellectual disabilities, particularly executive dysfunction, impaired mobility, and premature death, as well as like sleep apnea. There is an increased birth prevalence rate in Latinx population in the US, where we're seeing 4.2 individuals born with spina bifida per 10,000 births. So a little bit of a deeper dive into the topics I want to cover today. Again, this is the most kind of abbreviated version of neurogenic bladder, but just to make sure we're all on the same playing field. So of course, neurogenic bladder in general, you've got a miscommunication between the brain and the bladder. Through the nervous system, as well as then causing dysfunction in the muscles. This can cause either overactive bladder or underactive bladder. You could have a absolutely wide open urethral sphincter, making you very prone to incontinence, or you could have a very tight urethral sphincter, making it very hard to void. And because of this kind of mixture of different symptoms you could have, you may have issues with urinary retention, or urinary incontinence, or both. Also not uncommon to have secondary urinary reflux when the urine flows backwards from the bladder up towards the kidneys. You can have poor bladder compliance, which can lead to increased bladder storage pressure and eventual renal failure. We know that over 70% of individuals with spina bifida do utilize intermittent catheterizations just to manage their neurogenic bladder. And approximately 40% of individuals with spina bifida are able to be continent of their urine. There have been some studies looking for any kind of associations between urinary continence and social outcomes. And the only one that is sticking right now is that urinary continence is associated with increased employment status, which is important. Neurogenic bowel, the complement to neurogenic bladder. Again, dysfunction to the bowels this time. So we have decreased rectal sensation, especially of rectal fullness. You have an altered blood flow to the bowels, which can cause some dysmotility. I like to describe it to patients like a tube of toothpaste, and you've got, I'm going to stereotype, but I have mom here nicely rolling the toothpaste from one side. So you have a nice long contraction, and then toothpaste or poop comes out the other. And then you get dad or the kids who come in and just start grabbing the toothpaste anywhere they want. Maybe you'll get poop out, maybe you won't, because you don't have a uniform motility, and that is neurogenic bowel. You also have some alteration to the sphincter tone and sphincter function as well. So it can be a very lax sphincter. And because of that, again, you can have a combination of fecal incontinence and or constipation. So we know that about 80% of individuals with spina bifida do suffer from neurogenic bowel dysfunction. Along with those clinical concerns we brought up, there are some secondary health concerns, including urinary tract infections, VP shunt malfunction, usually reversible if you get them pooping, skin breakdown, hemorrhoids, or anal fissures. So before I continue, I feel like I have to talk about the National Spina Bifida Patient Registry, at least briefly. So a lot of the stats that I've already presented and a lot of the future research I'm going to show you comes from analyzing the data that we have been collecting since 2008 with the National Spina Bifida Patient Registry. So this registry, again, established in 2008 at the CDC with pairing up with the NIH and the Spina Bifida Association. It is a multi-institutional registry. All the sites on there have contributed data in some way. We now have over 10,000 individuals with longitudinal data within the data set, and the individuals within it are from birth up to over age 80 now. And 22% of those in the registry are Latinx ethnicity. This is a really awesome data set if you get interested in spina bifida. If you want to eventually work within this data set, you do have to be linked up with a site that is kind of contributing data. And from there, you can pair, and you put in like a short summary regarding kind of what your intent is, what your project is. It goes to a clearinghouse with the Spina Bifida Association and the CDC, and then they would work with you to analyze the data. So it's a really cool data set if you happen to be at one of these institutions or want to collaborate with one of these institutions. I'm going to kind of bump over. So we talked a little bit about the clinical aspects, but beyond these clinical health concerns, we do need to be aware that the quality of life of individuals with spina bifida is up to 34% lower than kind of a paired general population. So when that first statistic came out, there was a lot of discussion among researchers and clinicians about kind of what is the cause for this decreased quality of life? Like, where do we focus our research and our clinical initiatives to kind of improve this quality of life? And what we started, this was back in 2018, which was led by the Spina Bifida Association, was we first started by kind of creating these clinical guidelines for all the different body systems. These guidelines were created, and while creating these, we identified healthcare gaps and just gaps in recommendations. Particularly, there was a focus on the adult population. Again, as mentioned, we now have an adult population, which is fantastic. That was not something we had previously. So in doing this, we identified over 250 different research and clinical gaps for the care of individuals with spina bifida. From there, we took these 250 gaps, just a little overwhelming, and we kind of themed them up and grouped them just for the ease of consolidation into larger categories. The topics that had the most gaps within them then became kind of our prioritized areas to place our efforts. There were a total of 27 topics that got included, and we created a qualitative type of market survey. And this survey was then sent out back in 2019, and it was sent to those most affected by spina bifida. So we took it from the clinicians and the researchers and our opinions on, oh, well, it must be this or that that's causing these decreased quality of life concerns, and really brought it and broadened it to encompass adults with spina bifida, care partners of adults with spina bifida, and parents of children with spina bifida. So we sent this survey out through the Spina Bifida Association's listserv as well as their social media accounts. And we got over 1,600 respondents. The survey was available in both English and Spanish, and it was just a simple electronic survey. within this survey, we had all 27 items listed, and we had the individuals use a Likert scale to rank to the degree that that topic affected the individual with spina bifida's life. At the end of doing this for all 27 items, the respondents were then asked to choose their top 5 items that were the most significant issues or concerns for that person at this time. So here's kind of the most cited items, the biggest contributors to quality of life or just life if you have spina bifida. And you'll notice there's a theme. In parents who were answering on behalf of children, bowel incontinence was the leading issue, followed by urinary incontinence. For parents of adults, we have bowel incontinence in the top 2, just behind finding adult providers. And for adults with spina bifida, bowel incontinence and urinary incontinence both hit that top 5 list. So it's not just a concern to me, a clinician in urology, but clearly we kind of identified that these are real priority areas from the individuals with spina bifida and their care partners themselves. And I'm going to jump to this slide so it's up while I talk. So I could definitely go on for the full 45 minutes just about kind of how we went from that survey into creating a community kind of inspired research agenda for the Spina Bifida Association and the NIH. But in essence, we basically took all that information. We created a research advisory council within the Spina Bifida Association, where each subgroup has a leader, and then there are members, again, both individuals with spina bifida or affected by spina bifida, as well as researchers and clinicians who meet on a regular basis to try to tackle these priority areas. It's a really cool thing. There's more information on the last about how we kind of did this and how this might be utilized for other chronic conditions as well in the publication that was cited on the last slide. But in essence, at the end of all of that, we created this research priority list, research agenda. There we go. A research agenda which we are utilizing now. And so these are kind of the priority questions that have been drummed up by the group in regards to bowel. And these are the ones in regards to urine or neurogenic bladder. So these are the areas that both the Spina Bifida Association and researchers across the country in spina bifida are really trying to tackle at this moment. They're kind of our top priority. If any of these pique your interest, which is why I just kind of let them linger for a moment, please feel free to reach out. My email's on the first slide and the last slide. I help within the research advisory committee for both of these groups, and we're always looking for collaborators or people who want to work on any of these topics. My personal plug. Okay, so we've talked about how quality of life is important. We've talked about the clinical components and those important issues. But unfortunately, we cannot forget that money ultimately talks, even within the world of medicine. So I wanted to talk about a study we did a few years ago. The basis behind it is, as we all know, insurance coverage isn't universal here in the US. And sometimes it's just not available for certain products or procedures or medications. So in particular, for an individual with spina bifida, real problems arise when we have issues with insurance coverage for particular medications, for absorbent products, things like diapers, pull-ups, bed covers, chuck pads, urinary catheters to empty your bladder, rectal enemas or suppositories, or transanal irrigation products, which are a different type of product to help with neurogenic bowel. So just for one example, we did this survey amongst urinary catheter users. It was a collaboration between myself as well as the Spina Bifida Association, the Christopher and Dana Reeve Foundation, United Spinal, and Paralyzed Veterans of America. This was back in 2021. So here, as a kind of a cohort of nonprofits, and me, I don't know how I got involved, but it was great. We worked on this survey to send out to all of their members of their listservs. And we really were trying to better understand and determine what the true out-of-pocket costs were for individuals who utilized urinary catheters in the United States. And it wasn't just for curiosity, although that was part of it, but our effort was really to try to use this data to push and argue with insurance companies, with CMS, and even with the government to try to get some health policy changes. So we sent our survey out. We got over 2,500 respondents. 50% of them were male. 86%, I'm sorry, were adults, and the average age was 45 years. At the bottom here, we have the insurance plan breakdown. So about 25% used a commercial or employee-based insurance. About 46% had some sort of either public, government, or VA care. And 25% tended to be multiple plans. A lot of those were, Medicaid secondary with a commercial plan. And then a few that didn't know what they were covered under. And to take this a little bit further, we looked at just those who had that private or commercial insurance coverage. We have a breakdown there of the percentage within each type of kind of larger plan. The big takeaway there, 17% of those who had a private or commercial insurance plan said that their plan did not cover a single cent of their urinary catheter supplies. So again, 17% cover nothing for your costs of utilizing a catheter to empty your bladder. And we looked a little bit more briefly, and unfortunately, we found there was one insurance company that seemed to be a real standout, where 42% of the respondents said that their United Healthcare didn't cover any of the costs of their urinary catheters. We compared this to public or government insurance, and there the coverage was better. Only 8% of individuals did not get any coverage of their catheters. So when you look at how much is really coming out of the pocket to utilize your catheters, if you have government insurance, the yearly out-of-pocket expense was on average $531. Commercial or private, it was much more, almost just over 3 times that at $1,621. And again, this is after you've met a deductible or anything else. This is the out-of-pocket expenses. Again, significant here, United Healthcare kind of was a standout with the highest rate of out-of-pocket associated costs at over $2,000 in a year. Interesting to note too, because I don't know if you remember in the beginning of the slides, but we do know that urinary continence is associated with employment, which is more likely to get you a commercial insurance, which using a catheter is more likely to keep you dry. There's some interesting overlaps here to digest. This might be my favorite slide, even though it's not very visually appealing. But I'd like to coin the term a per P expense. So we did poll these individuals regarding kind of what types of catheters they use and how often. And we have that on average, the individuals were using 130 catheters a month, which is pretty standard, about 4 times a day. So this comes out to 1,560 voids in a year. So if you have private insurance, you're paying 70 cents per P. If you happen to have United Healthcare, you're paying $1.40 to pee. And if you have public insurance, you're spending 34 cents to pee, which I don't know about you, but all of those are more expensive than I would like. Especially interesting because you can find a lot of urinary catheters if you pay without insurance for about $1, $1.20 a pop. So some of these are actually more expensive than if you were to buy it without insurance. So to keep my complement of Bladder and Bowel, I did not want to put these slides in at this point. There is a very similar survey that was just carried out for bowel products, but we have a pending meeting with CMS about it, so I did not want to release that yet, but shortly. All right. I was trying to find a good way yesterday and today to make these slides flow a little bit more, but I just couldn't do it. So you're going to have to put up with a little of this dysmotility to the talk, but we're bouncing a little bit between bladder, bowel, quality of life, and clinical. But I just wanted to circle back again to the bowel component and just kind of highlight again the importance from a quality of life perspective as well, and to kind of adult success for these individuals. Because we know that if you are if you have any kind of fecal incontinence, it is really highly associated with decreased school attendance, lower educational attainment in the sense of beyond high school. You have lower rates of employment or are more likely to be underemployed. There's increased rates of depression, bullying, and also a really high rate of care partners. So whether that is a partner or a parent, to have their decreased quality of life, because most individuals cannot carry out a bowel program independently. So they are still utilizing care partners for their entire life. So this was a study we did, again, using that National Spina Bifida patient registry data. This looked particularly at fecal continence, and we looked at it by looked at it based on what type of bowel regimen or bowel management program the individual was using. Overall, we just found out that we're doing a terrible job at helping people achieve continence. So the overall continence rate for these individuals was just 45%, and we defined continence as having less than one incontinent episode, bowel incontinent episode in a month. So they were all having at least one bowel accident a month. If you look at it by the different treatments, even within all of those, none of them are fantastic. Antegrade enemas, which are a surgical procedure, had the best rate of continence at about 68%, but I could argue that's really not that great. We need that to go up a lot. We've also identified some associations on kind of health disparities and also disease associations between continence and with individuals in spina bifida. We find that incontinent rates are highest in those who have a higher level of their spina bifida lesion and those who have a decreased mobility status. We also find that males who have of Latinx ethnicity and are older age and are on a public or government insurance also tend to have the worst continence outcomes. We've got to close some gaps. Now, you may ask, why are we talking so much about the bowel and poop when we are here with CAIRIBU, which is benign urology? But I think it's an important topic. I know we all understand that the bladder and bowel are in close proximity and there's a lot there, but also spina bifida is generally cared for in multidisciplinary clinics. And some of the kind of body systems that are affected by spina bifida, it's really clear kind of which type of provider or which specialty is going to cover it. But we never really know who's covering the poo. And neurogenic bowel tends to get kind of tossed around and is seen by different clinicians and different specialties depending on what clinic you're in, which can make it really hard to make standardized guidelines, clinical pathways, or even to publish results in a journal that are read by the right people. So we did a survey of spina bifida-based clinics or spina bifida clinics within the United States to just determine kind of, okay, who's actually taking responsibility for neurogenic bowel? It has been underappreciated and undertreated. And we found in a survey of 51 clinics across the US, it's urology. We actually are the ones who are primarily responsible for managing neurogenic bowel in these multidisciplinary clinics. Behind that is actually rehabilitation medicine, GI, which I think a lot of people who aren't dealing with it regularly would assume should take ownership. That's really not their primary gig. Only 8 clinics had GI kind of as a primary provider, but they do assist quite a bit in many. In addition, many urologists are surgeons. I'm not a surgeon, but the urologists in the group are. And they are the ones who generally are also performing the neurogenic bowel surgeries. So it makes sense that this care and this knowledge has to be passed on to the urology providers. Okay, in keeping with my bouncing, I wanted to also tie in some information about urinary tract infections because I think we talk about that a lot within CAIRIBU. And the microbiome, which we talk about a lot within CAIRIBU. So I'll try to tie that into us here in the last bit. So as generally, I think we all have learned here, we know that urinary tract infections are a real problem. I work again in pediatrics, so it is the most common outpatient infection in children. And we know that in adults with spina bifida, about 30 to 40% of them still have at least one confirmed urinary tract infection a year, which tends to lead to a lot of antibiotic exposure over their lifetime. UTIs are also one of the most serious bacterial infections that are seen by pediatricians when they're caring for children, and they have a recurrence rate of over 50%. We know that BIPOC and Latinx identification also increases your risk of a urinary tract infection. When we look at individuals with spina bifida particularly, and their kind of concerns with UTIs, we know that, like everybody else, the antimicrobial resistance of the uropathogens is increasing. Use of antibiotics is extremely high. They tend to get overtreated for infections because with the introduction of a catheter, 3, 4 upwards times a day, you are introducing bacteria. So you often will get cultures that grow something, but of course they're asymptomatic, that they often will get treated despite perhaps maybe not needing it. We know that the individuals with spina bifida have a statistically significant higher rate of Klebsiella, as well as multi-drug resistant E. coli, and they are a 10 times increased rate of having urosepsis. So these episodes of UTI can be really challenging. Again, we know that in the adult world, the urinary microbiome can be associated with many benign urologic conditions. We should not be drinking our urine, even if you're Bear Grylls in the top right, and especially not if you're a child. And the healthy urobiome of children in a study that we just completed with the help of a CAIRIBU collaboration award, we were able to see some changes with the diversity amongst the pediatric urobiome. That seems to go up with age. There are also differences that exist between males and females at an early age, but this was really a pilot information and we just need to gather more. Now, again, comparing this and bouncing to the complement of the bowel, there has not been as much neurogenic bowel research out there as far as the gut microbiome. But in this study, which just came out, 2021, this was a systematic review of neurogenic bowel gut microbiome, but for individuals with spinal cord injury and multiple sclerosis. So obviously a different mechanism to how they different mechanism to their neurogenic bowel. But in the study, overall, it was found that the alpha diversity of the gut microbiome was lower in individuals with neurogenic bowel. Au contraire, more recently, just last year, this came out stating almost the exact opposite. What's interesting is this group from Italy, so this is not my research, but this group from Italy looked at the gut microbiome in children with spina bifida and neurogenic bowel, so the very specific group, and found that the alpha diversity of the gut microbiome was higher in these individuals. They also didn't see any differences in the way that their bowel was managed. They did just look at 3 kind of management protocols, one being no program, not doing anything, one being taking oral laxatives, so working to increase motility, and one being transanal irrigation. Transanal irrigation is basically using a catheter and putting it into your rectum, like a Foley catheter. So you put it into your rectum, it inflates a little balloon, and then you pump water in above that. So the water kind of goes into the colon, and then you deflate the balloon and it comes out. So you're getting a big washout of water, generally recommended to be just water, but a lot of individuals will add things like soap, Johnson shampoo, Perts Plus shampoo seems to be a big one, salt, Miralax. There'll be a lot of different concoctions that are sent in rectally. And what's interesting is they didn't notice any difference in the diversity on these individuals. So I think that's a very interesting study that hopefully we will continue to elaborate on and grow as our research kind of continues in this field. I sped through that much faster than I had on any of my practices, which is how this always goes. I had to cut slides earlier today, but we have plenty of time for a discussion then. And hopefully we've piqued some interest of some future Spina Bifida researchers.